Okay, let's get Jonathan Doe's medication ready for his injections. I'm just gonna hand sanitize here quick. Then I'd wipe down my surface. Okay. I'm just gonna start pulling out all my medication first. So out of the refrigerator, we have Manto or tuberculin. And so I'm looking for expiration date. That looks good. And it's, okay, I'm looking at all the 7 rights and it matches up. So I'm gonna set that right there. I'm gonna grab my other medication. So I have the Demodose and my diluent sterile water. So I'm gonna put that right there. And I don't see anything wrong with expiration date or anything. I'm looking at Demodose 520 milligrams. So, yep. One time, yep. Okay, I think everything looks good there. And then my promethazine hydrochloride. So, expiration date looks good. Just get that stuff out of there first. Demodose ampule, yep, 25 milligram, which is 1 milliliter, so yes. And then I'm just gonna take out all my packaging and like my needles and stuff. So I have this for the tuberculin, and packaging looks good. It's not tampered with, and the expiration date. I'm just looking at them for all of them. Syringe. Yep, that one looks good. And 10 ml syringe. That looks good. My 2 needles. That looks good. And then my opener for this. Yep. Filter needle. Expiration looks good. Packaging tampered with. Needle. Then my labels here, promethazine hydrochloride, 1 ml. Yep. Date and time looks good. 2.6 mils. So Jonathan Doe, Demodose. Yep. And then Manto, 1.1 ml. Okay, so now I'm just gonna start. Oh, I need some alcohol swabs right here. Okay, I'm gonna start with the tuberculin here. So I'm looking at the 7 rights again, and expiration date looks good again. Tuberculin, 0.1 mils. Okay, I'm just gonna take this here. Take this out of the packaging. First, I'm gonna clean it. It's nice and clean. Take this out of the packaging, making sure to only touch. Don't touch the plunger. Pretend that cap was on there. Okay, I'm gonna pretend that again. So I'm taking this out of the package and everything looks good. Okay, I take this off, set that up right so I can recap it. I'm gonna go to 0.1 mils. Okay, of air. I'm gonna put this in here, and I already cleaned it. And making sure not to put the air into the fluid itself. And then I'm gonna turn it upside down. Mils. No air bubbles. Okay, I'm just gonna recap it. Then I'm gonna label it, making sure not to cover up the medication. Okay, I'm just gonna set that on my tray here, which is sterile, which is clean. Okay, so that one is all done. I'm gonna put this back in the fridge. Okay, now we have the antibiotic for his pneumonia. So I have my diluent here. and then the med itself, and I need to reconstitute this. So next demo dose, 200 milligrams, 10 mils, and then we've already done the math and it's 2.6 mils. So everything looks good, expiration date looks good. So I'm gonna start doing this now. Open these up. Okay, start with the sterile water here. That's all clean. I'm gonna take my 10 ml syringe here, and the packaging was good because I checked them in the beginning. So then hold that up. Take one of my needles here, 23 gauge. Make sure to keep asepsis. Okay, I'm just gonna do that. I need to get 10 mils of air first. Okay, do like that. Being sure to get the air only, the air, not in the fluid. Turn it upside down. 10 mils of water. Making sure to only touch the plunger. Get some of those air bubbles out of there first. And I'm just going to continue getting those air bubbles out. Pushing up to the 10 mils in the garbage. Okay. And no air bubbles in there. I'm just going to swoop it up. Okay, I'm going to set that in my sterile field here. Oh, wait, I'm actually going to start doing this right away, so I'm going to hold on to that. Clean the top of this up. I'm going to put this into my intention here. Get some extra air out of there. Okay. Okay. Let's get rid of that one. Swoop method. Okay, I'm just going to set that in a sterile field here. I'm going to mix this together in the palms of my hands. Making sure there's no leftover particles in there. Looks good. So I'm going to change this needle here. Get rid of that. So I'm getting 2.6 mils, so some leftover. .6 mils of air. Clean this again. Get the air in there. Perfect. don't see any bubbles. Cap it. And then I put on my different needle here. So I'm gonna take this needle off here. Put it in the sharps. And do the same thing with the other needle here, because we don't want a dull needle when we're giving it to the patient. Now I'm gonna label it. Make sure not to cover up how much is in there actually. Okay. That's in there. Okay, so now I just have my promethazine hydrochloride, and I already did my another check here. Everything looks good. Okay, so first thing is to break it. Okay, and make sure to break it away from yourself. And all that fluid is on the bottom. Okay, put that back down. Take this out. Put that in the sharps. Okay, now I'm just gonna get my syringe here. Hold that up. Get my filter needle. Okay. Then I'm gonna clean this. Okay. Making sure not to put air in there. I'm just gonna be really steady. We need 1 ml. Some extra air in there. I'm gonna do this over the garbage. Okay. I'm gonna pull back a little bit so it's out of the needle. I'm gonna recap this. Throw that in my sharps. I'm gonna grab my other needle here. Okay. I'm just gonna push it all the way up again. I've got 1 ml. No more bubbles. That is 1 ml. Okay, and it's already capped. I gotta label it. Okay, and I got some I got a sterile alcohol pad and then some cotton balls, and then this is gonna go in the sharps container. Just gonna clean up after. I'm gonna put this back in here. Take my pen with me in case I need it. Okay, and I think I'm ready to go in there. I'm gonna grab some gloves before I go in there. Okay, got some gloves, put those in my pocket. Okay, bring everything in there. So, hand sanitize. Knock, knock, knock. Hi, Jonathan Doe. This is Madison Maley. I'm the student nurse. I've got some medication here that's going to be injected. Is that okay? It should only take 5 to 10 minutes. Is this an okay time for you? Yes? Okay. So what I have here is some tuberculin, and that's just going to test for tuberculosis. And we're going to put that in on the bear on your forearm here. I'm just going to check here, our arm here, make sure that there's no lesions. Oh, and your last name and date of birth here. Can you repeat that for me? Okay, perfect. Okay, and your allergies. Okay, and your forearm here. Looks good. I don't see any lesions, any redness, no tattoos. That looks good. And then I'm just going to explain the other sites here after I'm done explaining. So your Demodex, that's an antibiotic for your pneumonia. And that's going to go in your vastus lateralis, in your ventrogluteal. So I'm going to just explain where that is. So I'm going to have you turn on your right side, maintaining privacy. Okay. So you put your, he's on his right side, so I'm using so I'm using opposite arm. So I put my palm down on the greater trochanter, and then my pointer on your anterior iliac spine, and then my middle finger on your iliac crest. And then right here is the safety zone, and then your vastus lateralis. I'm gonna split up your leg into 3 with my left hand on your femoral, can't think of the word, and then above your knee, so just right there, and then it'd be like right there. Okay, covering up here again, and then we're going to be putting your promethazine hydrochloride. You can either put that in your deltoid or in your vastus lateralis. Which one would you like? Deltoid? Okay, so then to find your deltoid, you do your pinky on your finger on your pinky on your acromion process and 3 fingers down. So it'd be like right there. So, okay. I'll put my gloves on here. I already performed hand hygiene. I would raise the bed up for this. Oh, we've got this thing right here. Okay, so we're gonna start with your tuberculin here. It's there. And this is gonna go in on your forearm. Clean it. 2 inches out. That's gonna go in my garbage. Then I'm just gonna do my 3rd check here. Manto, 0.1 mils, and date, time, and my initials on here, and that looks good. And I waited till that would dry, and then I'm gonna uncap this. No bubbles in there. So I'm gonna I'm gonna hold the skin taut. I'm gonna go at a 5 to 15 degrees. Okay. Down here. I'll lift up gently and go slow. Okay, and it made a little bleb there, so I'm going to recap this needle and put it into the sharps container. Okay, and then I'm just going to clean this up again. And I dab with a cotton ball, making sure not to spread it because you want to be able to know where it is. Okay, just cleaning that again, working my way outward. Okay, so now we've got your demo dose here. So we're going to use a C-track for this. I'm looking at the third check here. Jonathan Doe, demo dose, 2.6 mils. And it's 1 time, date and time is good. So I already cleaned it and it's dry. C-track here, so I'm going to hold one side. I'm going to go in at a 90-degree angle, and it's going to go fast. And I'm just going to do this 15 to 20 seconds per mil. It's pretty slow. And let go at the same time as you're letting go of the skin. So then I'm going to that again, put this in the safety in the sharps container. Okay, We've got one left, and you wanted this one in your deltoid, correct? So promethazine hydrochloride, and this is for your nausea. Okay, so I'm just gonna clean this up again. Working my way out. Okay. And then I'm gonna grab this here and make sure to check again. Promethazine hydrochloride, 1 ml, date, time, my initials are on there, and it's for Jonathan Doe. Okay, so I'm gonna take this off, and I already cleaned it. Okay, and then this is gonna go at a 90-degree angle again. And I'm gonna hold the skin taut. Go slow again. Okay, well, I'm gonna put the safety on. Okay, I'm gonna bring that to the sharps container. Okay. And then I dab it with a cotton ball and put a band-aid on there. Same for the, then for the demo dose, making sure not to massage because you don't wanna make sure that doesn't go to subcutaneous and cause inflammation. Okay, I'm just gonna clean up my stuff here. Here, I'm gonna take my gloves off. Do you have any questions about what we did today? No? Okay, well I'm gonna lower the bed and I'm gonna place the call light. I'll be back in a little bit to check on you, see how it's working. Okay, well, if there's nothing I can do for you, I'll be back in a little bit, and then I perform hand hygiene on my way out. So.